or antidepressant as such. And this is what I was trying to stress to the doctors. I've gone to Johns Hopkins, I've gone to University of Maryland, and not only that, I get real bad headaches.
On any of those other things. Okay, so the atenolol is not bringing down the top pressure, and your bottom pressure stays very, very low and sometimes gets lower than what it should be.
That's correct, but I stopped taking atenolol because it did nothing for me, although I've been on it for like 100 years.
Okay.
And so
right now you're not taking any medication, is that correct?
Yes, I am. I can't be walking around with 190.
I agree. What are you taking?
Total XL, a total of 175 milligrams. And I don't know if that's giving me the headache or the pressure or what, but it's...
Actually, one of the side effects of that medication is the headaches. But also you have to look at it that high blood pressure will give you a headache, and that's the problem.
I've never had that headache before.
Well, it depends on how advanced. See, blood pressure often has to do with hardening of the arteries, and as you start pushing more pressure into the arterial system, if the blood vessels are narrowed, you're going to start having more of a headache. Also, an inflammatory response, high levels of inflammation within the arterial walls will also cause headaches to begin to come about. But the drug you're taking as well will that's one of the side effects. Now, having said that, please understand, I'm not telling you to get off of anything. But what you may want to do, and I don't have the time to get into it in depth, but if you get a hold of me through the website at rosellecare.com, I will give you some more information. But listen to this piece. Staying on the medication that you are on right now, in addition to that, try magnesium glycinate, the glycinate form of magnesium. And you want to take about 200 milligrams 3 to 4 times a day. And the only side effect of taking that level of magnesium might be that you get a little bit of a loose stool, but it's not going to hurt you. So, but after about 4 or 5 days of taking that level, you're going to get yourself up to maybe 800 to 1,000 milligrams of calcium glycinate divided over a period of the day. Watch that top pressure. You may begin to see it come down. You have the top pressure represents the amount of force within the arterial system when the heart contracts, and your arterial system is not relaxing enough to allow that flow of blood through the system, so it's registering that as an increase in pressure. So try the magnesium glycinate, but make sure you're drinking enough water during the day. Water is critical no matter what the situation is. You have to make sure you're drinking at least half of your body weight in ounces every day. Take the magnesium glycinate. Make sure you're not drinking any coffee or black tea or any alcohol, and you may not have any of these in your diet. Nothing fried, and stay away from gluten, anything that is made out of a grain, for a short period of time. See if just doing those things will drop your blood pressure. Gilda, get a hold of me on the website.
I don't have a computer, doctor. I want to make an appointment to see you, but they said I cannot see you.
It's very difficult to get in to see me, but...
if I don't see you, I'm not going to live.
Well, honey, I have 5 doctors in my office that are some of the tops, and they know this work, and they know it very, very well. Why don't you call me, and I'll tell you which one of them to see, okay?
Okay, so you'll tell... In fact, a couple of weeks ago, I tried to make an appointment. One of the girls said, I'll call you back. I never heard from her. I called, talked to somebody else. It's the same thing. I said...
Well, I'll tell you what. I'll take care of that. You call tomorrow, and you leave a message to tell them, leave your name and phone number, and that I talked to you on the radio, and that I will call you back, okay?
God bless you. Have a blessed holiday.
Thank you, Gilda. Appreciate your phone call.
Thank you, sir. Bye.
We're here at 888-630-9625. We're talking about exercise and how to increase your growth hormone. We're coming up to a break, but when we come back, I'm going to give you the skinny on this, the end piece of how to put it into place, what you need to do. And remember, it's only going to take 20 minutes of your time a couple times a week. That's it. Isn't that worth a little bit of effort to try to stay on this planet longer, but live well and live to your potential? I think so. I'm doing it for myself coming up in 2011. I think you should as well. And I'm going to give you the secret of how to do that and how to turn things around, perhaps maybe for the first time. You're listening to Dr. Tom Roselle Live. We've been here at 888-630-WMAL. Love to talk to you on any subject, always. If you'd like to re-listen to this program, you can go to WMAL.com on demand, and it should be there by Wednesday. You can get it and put it on your iPod. You can re-listen it right there online, whatever you'd like to do. And as always, if you're not in the area, go to WMAL, listen live, and you can hear me no matter where, if you're on the road or doing whatever you need to do. Talking about exercise that will turn your life around, that will increase your growth hormone. It's totally true. It's something that you need to do. I want to remind you that if you'd like to get part of your health profile done in a way that you can really get a baseline of what condition your cardiovascular system might be in, this is an opportunity. Coming in January, Thermography Centers of Fairfax is offering a special to start out the new year. Full-body thermographic examination. You can find out all the problems that might be showing up. Some cancer problems, particularly breast cancers, ladies, 5 to 8 years before it shows up on mammography. You can find out what your cardiovascular system is doing, particularly the arteries that go to your brain and your neck and the lower portion of your body as well. Give Dareth Painter a call at 703-943-7248. That's 703-943-7248. And ask her about the January special, full-body thermographic imaging for $400, normally $475. I wouldn't hesitate. I'm getting it done the first week of January. You need to get it done as well. Call her at 703-943-7248. Okay, let's talk about how to implement this exercise routine. Well, here's the deal. What you need to do is you have to begin a body that is warm. So warm up nice and slowly, and as your body begins to warm over 3 to 4 to 5 minutes, then what we want you to do is at that point you need to exercise as hard as you possibly can for just 30 seconds, no more than that. Matter of fact, your exercise ratio should be so hard that you can't even breathe almost, and you're kind of gasping for air. Then I want you to kind of just slow it down and just walk. Now, you can do this on a treadmill. You can go outside and do it. You can do it on a bicycle. You can do it with weights. You can do it with all kinds of different exercise. Then 90 seconds of total relaxation. And then you do it again. After 90 seconds, you kick it up for 30 seconds, as hard as you possibly can. Get that to kick in, and then slow it down for 90 seconds. Now, if you haven't been exercising before, you may only want to do this routine maybe 3 times. Then as you begin to improve, then you get it up to 8 or 9 or 10 times, and that's where the magic begins. Once you get it up in that area and you get into your anaerobic rate, that's when it begins to stimulate the production of your growth hormone. But you don't want to keep it there consistently, and you don't want to do it more than a couple times a week. If you're younger and you're in great shape, maybe you can do it 3 times a week. But here's the deal. Anything more than that, anything other than what I'm describing to you, will actually reverse the process. And you want to get to the place where you can barely talk. You're in oxygen deficit. And as soon as you begin to do this a couple times, you'll begin to sweat. And, your body will start kicking into circulatory patterns and so forth. What you can notice is you're going to decrease body fat over time. You're going to improve your muscle tone. Your whole body's hormone capacity is going to start increasing. But this exercise and any other exercise, make sure you go get a physical. Make sure you get your doctor's approval and said, yes, you can begin to start exercising slow. Start exercising slowly, a little bit at a time. Remember, this should be done 8 or 9 or 10 times, 30 seconds on, 90 seconds of slow relaxation, getting it way down, just kind of going slowly, then kicking it back up for 30 seconds. You want to work towards over a period of time where you can do this 8 or 9 or 10 times, but in the beginning you might be able to only do it 2 or 3 times, and that's okay. Where you're at is okay. Remember I told you about a nutritional product, glutathione. Glutathione is the magic nutrition. By itself, not so much. With this, absolutely, it works, and it works really well. Keep your vitamin D level up, watch your diet, increase the water intake. If you're low, make sure you're eating a lot of vegetables, high-quality proteins, and you'll see some beautiful things happen to you. If you'd like to see more, go online to rosellecare.com. I will post the whole thing real quickly. This is Dr. Tom Roselle. See you next week at 12.